All right, for Sabri Brasso say ye dwumadi a yɛato no din healthy nugget no yɛde ɛbrɛ mu sɛ mobɛkae a the last couple of weeks a yɛbaeɛ no yɛhwɛ ɛyɛ adesua na yɛhwɛ fainting ne sudden cardiac death sɛ wɔwɔ hɔ a na obi atwa hwe obi twa hwe adeɛ na ɛsɛ ɔyɛ I believe sɛ the first part no ɛboa wo ma wohu nneɛma bi a sɛ sɛ wokora biribi ti a wobɛhu deɛ wobɛyɛ ɛnɛ doc wɔ ha ɛyɛ Dr. Stephen Manu ɛwɔ ha ɛnɛ nso wɔde part 2 no ɛrebrɛ yɛn ɛnɛ more questions ɛbɛba ɛne responses ɛbɛba ɛno nti ne doc mɛmu akɔ aba
Yeah, Jamie Johnson.
na apɔ mu tete
Yehovah Dom, I'm on swear.
nyankopɔn adaroma biribiara bɛkɔ ansa ne yɛbɛkɔ anim kora no doc mɛmu abɔ mpae ama ɛ mɛmu abɔ mpae ama ɛ
Oh, okay. My mom by Japan was so that as I brought Dinibium. Kunya de my sentiment shemuni and sianstem. So never boy a home buying. Yes, also very obedi any more kind na nye jumedi beno. Be sure would have me dini a compon and yam. And there was so shines and what kind home. The by yes Christ dim. Amen.
Amen. Yeah, Doc, first part no amanfo bebree ɔmo ani gye ho ne adesua a ɔde baeɛ no na ɔsɛ yɛnwie nti no ɛnɛ kakra a ɛwɔ hɔ a ɔde bɛba no afei questions no nso asa aba nti by the way sɛ wohwɛ live right now anaasɛ akyire koraa na wobɛhwɛ a wobɛtumi de wo questions and contributions agu ɛyɛ comment section hɔ sɛ wohwɛ through Facebook anaasɛ YouTube a wobɛtumi de ne nyinaa no afa hɔ na yɛbɛtumi aboa na biribiara ayɛ kamakama paa nti Doc megya akyire ama wo.
Okay. Yo, Tisana, you can't last no. It's the last time you shine your car. Syncope and also be trashy. Any sudden cardiac death. Now, say I'm saying you call you might be we talk you about what are some of the things that cause and also that bring about so be a trashy. And the guy said there was many different causes of passing out and also be trashy no. Ebia suddenly when one said na moja na wo chim no a coming down as a flow down mainly because of ebia say ebia sorry prekope no was probably that was the most common cause of passing out. And I face a car about maybe brain problems that can do that, and as well as mainly the focus was on cardiac reasons. Say be have a heart rhythm problems, and now say be or a heart attack, and I say heart failure. Those sort of things, were some of the causes of passing out, including maybe a yarebi or now, I'm saying towards the end, no, we went through some of the things that you can do to minimize and also to prevent the risk of passing out. One of them, the most important perhaps, has been keeping hydrated. And that's to the brain. Lots and lots of water is probably the best way to prevent passing out. And that's so retraction. It's one of the best ways to do it. I mean, at the insular minds here, no. And in fact, when you drink it, that is the most effective way to avoid passing out. So the car, say onum so bebree now what the yen say it's me filling you up a lot of fluid inside your system no that way even when you go down and I say when you brew I say there will be some amount of volume and some amount of volume in your system which will help keep the brain full of blood and also full of fluid which will help you not pass out and drinking water was a very important one. I think is caffeine was a big one where because caffeine makes you a so be brain into here we are trying to avoid passing and also we're trying to keep a lot of fluid in your system no and so no say yeah or no coffee now it's so be brain and it also doesn't really help and I can say exercise is another big one because exercise will help strengthen the muscles in your legs and in your core no when you do that now those muscles act like little pumps to help pump blood up into the brain so that's another thing that is very helpful and of course healthy eating, no, because we need the nutrients in our bodies. That some of the things that will help with passing out. And and then what I wanted us to talk about, was an extension of that. We've talked about the individual person, but how about in a community setting? For example, ebi a last kind of you want sorry them na ebi a suffer na bompa anyway, ya to nyoma wie. Na ebi a beto nyoma no bi sorry prekupe no. And this will bring a otwa hwe Now, then, yeah, yes, happen when something like this happens in a closed space setting where we're in the middle of a service, no, that's a weird crash here. What should we do? What I wanted to briefly go over no, was to really summarize this into three parts. I'm actually into GBC, say Ghana Broadcasting Corporation. But the point here no, is really ground, breathing, and then circulation. These are the three things I think that it will be helpful for us to remember if somebody were to suddenly collapse and has to be a trachea. What should we do? The first part no, is ground. No. In other words, first thing is if I can't be out that form, I try to that form. No. What we need to do is make sure say, yeah, man, or better, or person or sorry, or not because a person sorry, we need to help the person come back down. So person sorry, immediately help the person come back down because or sorry, now one shall be a trash view. And it's very, very important. So be a trash to help them lay flat on the ground. Yes, about on that honor as quietly as possible for some time. But the honor now said, who said on Timin so and so yeah on Kaka the first thing is of course to make sure say or the hot dinner just on prepare no be. And the first step is to make sure that you can prop the feet up. And I say, prayer and I across the And the reason why you do that, and they say it will help bring blood from the lower extremities, and that's a free. And I know, and it will help sort of drain blood back into the brain, which is what we need in a setting of so be attractional. Now, face we in Tadiana, one honor be a belt, be a trap. And I say, be a share corset, and then be a way to kind of loosen the clothing, so now they are able to breathe a bit easier if they're actually breathing out and to allow a lot of fresh air. But the key point I want to raise when the person is on the ground is to check whether they are conscious or not. Are they awake? And I say, are they, still showing signs of being awake? If they are not, then we need to check. In other words, friend, sorry, and not just kind of calling their name, just letting them see that if they're actually awake or they'll respond to you. But if they are not responsive, you said there's nothing really responding back to you now, then the next thing becomes to check or humi and this takes some time to sort of just listen and to watch the or train from a say just that's the breathing pattern. So we put them on the ground first for ground, make sure that they are quiet on the ground. The second part is check see if they are breathing or not. And if they are now, great. But if they are not, then we need to talk about rescue breathing. But even most of the time, the key of the whole thing is making sure that you can get their blood back into their brain. And so what the key now is to check for pulse. So to check obi circulation has to be pulse. What you need to do is to take your hand and then around hand around the forearm area, you can feel for the person's pulse. And that's what my fit, but my to say, na udin sa kwan ma but my na kuma na ebo pim pim pim. But say won't be a hono ma. That's what the no koko so na say won't say na kuma body then you know say na kuma no edgina. And there's something that we need to do immediately. And the key point here being says CPR. And I say being able to help the heart pump, is the time to do that. As an example, I did to for these, say and I corner the hormone flat now the sa I can't boom sa now when me and cook on so you want to be able to push down quite hard to be able to get the heart to pump. And the idea is to go about 100 beats per minute. Just a steady, kind of a pumping, is going to be very, very important. And another really important thing about CPR is from now, so to me and you need to release the pressure and I say let go, so that the heart can fill back up with blood again for the next push down. And being able to allow the whole recon, letting your hands come up and then pushing back down as deeply as we can, at least a third of the way down is very, very important. And just being at a very consistent but fairly rapid rate will be helpful. You don't content brain, so content brain, so then that means that you're not allowing enough blood to come back into the body to be pumped out. And when you're in 10 times, so not so in too slow, so then you're not doing it quickly enough to get blood into the brain. So just being able to go at about 100 beats per minute. They use the song, I'm saying, we are seeing da 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 da, saving a life, that kind of a beat, is sometimes very helpful to help make to give you the timing of doing the CPR, And doing CPR is essential. And because it's a church, and I say in a crowd setting, while somebody is doing the CPR, no, the really more important thing also that we should be doing at the same time is getting help. That is called 911, because 911 will give you very good instruction of what to do. They'll give us very good instruction of how to do the CPR, no, when to continue, when to stop, what to do, no. Having 911 on board, no, is very, very important. And many times we say, first of all, get the person on the ground. Second, no, is to actually get 911, get somebody on the phone, no, with them while you're checking the pulse, no, while you're checking their breathing, no. Make sure say somebody is calling 911. I say your own make sure that you're on the line, not trying to get emergency service. I think this is something that's very, very important. The final thing I want to remind us, no, is that defibrillators need be I saw them and I say in public places, no. These things are life-saving. They are very simple to use. Fortunately, it's made to be very user-friendly. And so, it tells you exactly, it said, yeah, so yeah. And that's also Rebecca Charles said, put the pads on, not or Charles, put the pads on to now for pads in the woman, and they're born a so usually there's two of them. There'll be very clear pictures to show you where to put the patches. Now Rebecca Charles said, analyzing to also because don't touch the patient. So during that time, nobody is no CPR now you see giant machine analyze what's going on. No? And many a times it will tell you, say, shock advice. And I say, a shock, yes, I know, yeah. Then what you do is you don't touch the patient, and I'm not gonna say it'll count down 3, 2, 1, not shock it. So in that sense, because I said no shock advice, not just a continue CPR. Na ama so I shall CPR and so now I just what was so and nobody and once the pads are on, it's very helpful because now it can give you times, and usually you want to do 2-minute cycles. And every 2 minutes you have to stop the CPR, no, and check the pulse, maybe checking the breathing, make sure that the person is still unconscious. If they're still unconscious and after there's still no pulse now, it says resume CPR. Now I start to a CPR so until emergency services not be drawn, and they will take over. And then to know the key thing again being said, number one, making sure the person is relaxed on the ground, on the floor. Number two, making sure that they are breathing, checking their circulation, making sure that the heart is pumping. In the meanwhile, no, what Fred 911, I say we have Fred emergency services someone around and then using the AED, as soon as we can. The moment somebody passes out, that another person is reaching out to go find our AED, and we all need to know where the closest AED, is at, so that somebody can go grab it and bring it and do all these things. Many a times. The good news is that if somebody can put the AED on the person, that's a cardiac arrest and quandia, most of the time, it can revive the person. And these are very, very important points I wanted to raise. But I'm saying many times big traffic and dangerous. Most of the time, it's not dangerous, especially if be a summertime, baby, it gets very, very hot. The air conditioning most of the time people are passing out because of things of this nature. Horse shit, blood has not gone into this brain, and traffic because of that. Was so preoccupied with traffic, and also, most of the time it's not dangerous. But it is important to act quickly and to act very smartly. And that I wanted to raise that point. Secondly, is that CPR education is very, very important. Seeing CPR. There are many, many courses out there, online, in person, to take CPR courses. I bet you how to do effective CPR. And in United Nations, it's me boy. The bomb I say be your problem CPR, but when the time comes now, it is important to be able to do it effectively. And then the third point I wanted to raise is that AEDs are very, very life-saving. Sometimes, in the church sections, and as I meet in those areas, if you sometimes being able to even reach for grants can help because still be anybody can cry. But with grants and with donations, oftentimes there's some companies and some organizations who will freely give you an AED, who will freely give churches an AED if we ask for it. And the key is to ask and to seek for it. You almost always will be able to get one to place sorry them when I say the better issue. This is just a very quick summary of what to do if someone were to pass out. The idea is very, very simple, but in the middle of it, it can be very, very difficult to remember what to do. That's also the simplicity of it, having the person lie down, checking their breathing, checking their pulse. If they don't have those things, administering the CPR, not getting a and of course calling emergency and that's a 911 phone. Team that Manu be saying that say.
Mm. All right, Doc. Nyame nhyira wo. Sɛ ka wobɛyi wo slide na ama yɛ PowerPoint no. All right, all right. Thank you so much. I think what my a lot within these few minutes. No, first of all, question maybe sir, and they say, let's assume so be a trash. What check a post no, and also offer CPR, but only licenses, only CPR licenses. Saa nipa no obetumi go ahead na what try compressions no and now so only licenses no internet ni kwaso de nsa ka nipa.
I think the key here no is something is better than nothing.
Okay.
And then, so we need license to crown, so you be cramp now. It is important to, and then the what to be, and to
Mhm.
take what the knowledge you have, no, and to apply it. And then, when you be cramp now is to do something, and to try the CPR. No, it is important not to ignore the situation. No, I think that it is better to do some CPR than to do no CPR at all. And so wait me, and I want to encounter when I wait me here, I want so.
Nti de hia sɛ mfa nsa nkosi ne yam baabi a
What
wobɛ
you say?
mesi de hia no sɛ nipa no mfa ne nsa nkosi ne yam na
I
wɔmpiepie
know, I don't know.
nti
I know, I don't
ɛntɛm no
know.
mepɛ sɛ wosi so bio ebia no
Person ako,
mekɔ
I know, I don't know. I know, I don't know.
nti dɔk mepɛ sɛ wosi asi so bio ebia na
Uh-huh.
DPR no obi a wɔtie ɔnyɛ bi da anaasɛ bia baabi a akɔto no sɛ ɛnyɛ wo yam na ɛyɛ wo
Debbie, yeah,
hemfa
yeah.
wo
They were
hemfa
so right
aha
in the middle of the chest, no, right in the middle of the chest, no, it's where you want to be able to be to push as much as possible, and also that thing that's helpful is so doing some say now
okay
the near so
mm.
in the middle of the heart, no,
Mm.
the chest, no, that is very very helpful.
Okay yɛda se ebio another question, yeah, now o emphasize on say you didn't pan beto form. Say yentimi pan to mpa so na yenye. Eno no adenti na form. Ana
Yeah, it's a
yetimi
good
gyina so.
question. It's a good question. Formally, yeah, because also, yeah, I had on the background. You want a firm background, and pass na emuye too soft. It's too mean obre. Ultimate CPR ni ye. Ultimate good compression,
Mm.
on the chest. So it's very very important. Said bakono, walk flat on the ground so you can get good support as you do the CPR. No. And so dampemwa, it's very important to either put a backboard, something behind them, and also on the more easily on the ground and then do it from there.
Okay. Deɛ me amede m'ani ehu bi yɛ ɔmo a yɛbɔ ɔmo nsuo ne ade. Na mepɛ sɛ mebisa sɛ nipa no let's assume sɛ oni pulse ne ade. Saa afɔ no sɛ ɛsɛ yɛbɔ ɔmo nsuo ansa na yɛayɛ CPR no ana.
So that be, I mean, one fancy room be. I mean, one petition by Nyan man back on Nyane. Oh, so man back on Nyane. I think that the key, is CPR. That's the key of the whole thing. That's what's life sustaining. Is actually being able to circulate the blood in their body. We need to be careful. If you bring that up, say, oh, this is so good back on, so it'll wake them up. It may sort of revive and as startle them, but sometimes you don't want to make sure so you might choke them, because at that time they're not protecting airway. So you don't want to be giving people water to drink and that sort of situation. What you do want to do is just make sure they are relaxed as much as possible. You're doing the CPR, they don't have any pulse, and then just wait for emergency for some umrah. And just have a fight, so they're going to that kind of a thing. I know those
Okay.
things don't help.
Yeah, na me nka deɛ de gu n'anum na me ka ɔmo a yɛbɔ ɔmo nsuo no. Like yɛde nsuo yɛpɔ water on them.
Oh, like my hood patron, yeah.
How would pouring water on them? No, I said,
Pouring water on them. No.
uh-huh.
that that can be actually quite dangerous. The point is that if it's icy water, no, once the ice water tends to ignite reflexes in our bodies. It can make the person react in a certain way, but it also can be quite dangerous because again, they may pull some of the water into them and choke themselves. Things like that. And it's important to minimize those sort of things and to really avoid them. The key again is what I've kind of went over now, is making sure that we can get the CPR going. And so there.
Okay. Nti montie mu sɛ yɛaba abɔkyire deɛ Ghana deɛ ɔyɛ ɔmɛbɔ nsuo sisi a alright. Deɛ ɛtɔ so bio nso ɛyɛ sɛ nipa no otimi home ba wɔatwa ahwe saa afɔ no nso no ɔmo no yɛnyɛ CPR ɔmo no deɛ na ɛsɛ yɛyɛ
Yeah.
home wɔ hɔ ba wo
Home wɔ hɔ.
ahwe.
Yes. Yes. Ne home wɔ hɔnom. Ne home wɔ hɔnom when or pause, but what so ultimately responding.
Yes.
Yeah. So at that point, there the only thing you can do is to get them help. Is to get them help. As long as you can tell that they are alive and they are breathing and they have a pulse in there. Even if they're not responding to you now, friend, sorry, so no one responded. The point at this point is to get help because number one, they are alive. And
Mhm.
that's the whole point, is to make sure that they have life in them. And if they have life in them now, then what you need to get is help because it could be a whole host of reasons why we're trashy. Is it, there's many things, and at that time you may not know which one is going to help them. The best way to get help is to call for help and have the emergency people who come help them figure out what's going on.
Ɛna thank you ɛno nso de yɛnyɛ CPR nipa no home
There be on me or pause the how they CPR there be.
ɛho hia me because you see yɛka CPR yɛnka sɛ obi twahwe biara na ɔyɛ CPR
No, this is CPR.
daabi sɛ home no wɔ hɔ ne nipa no bi a wayɛ mmerɛ ne ɔda hɔ a no de yɛnyɛ CPR na mmom
There be.
ɔhome na wokyɛke pulse no nso na womfili a ɛno na wotumi
We
akoma
CPR. Yeah.
ɛbɔ a na wotumi yɛ CPR doctor mi nso
Yes.
ebio
Yes.
ebio nipa atwa hwene yɛwɔ mu ahodoɔ yɛwɔ seizures ɛne sɛ nipa no afenti ɛno no ɛbɛdɛ yɛhu nsonsoyɛ obi anya seizure
Mm.
ne obi afenti no nso
Yeah. Yeah, so seizures, yeah, see, seizures now, that's usually a brain problem. We're talking about something wrong with the person's brain, and that's if they have a seizure episode. No, seizures come in many different forms and types. Many a times, they can come in the form of what they call generalized tonic-clonic, and I say ben bakono also. Now you can tell, so that oftentimes is that may be what is happening. But it's very difficult to oftentimes tell the difference between a neurological seizure and a cardiac arrest because we be trashing from a cardiac arrest that they could also seize, and so they're seizing because of it, because the heart has stopped working and they no longer have blood into their brain, and so now they're going to seize. To which is which? Is it because they seize or because they have a heart problem? And at that time, no, the point is not to really try to figure out what caused it, but the point at that time is to provide help and to provide safety for them. And to know as long as we're able to make sure that they are safe, and if so, who said it's clear there's a seizure going on now, one thing that can be helpful is that, and as long as they are again breathing and they have a pulse, you can put them on their side so they don't bite their tongue, or lacify themselves. That can be a lifesaver. At that point, in the acute situation, the point is to provide life-sustaining help, whether it's a seizure, whether it's medicine like overdose, those sort of things, and the acute setting there, it's advisable not to try to guess, but to just provide help, life-saving help to them as needed.
My last NASA youth camp meeting I call ye more march no you won't say beam twitwa mo etwitwa hwe because of say bi almost stand fainting ne saa nneɛma no
Yeah.
course bebrebe ɛno yɛ obi bi wɔ hɔ a wɔbɛtumi ayɛ to prevent that na ɔno a wogyina hɔ na no ana adeɛ ne ne kɔ so saa.
Yeah, it's a good question. And Nana Boni friend or friend with this vasovagal syncope. In other words, what's happening, let's just say if somebody has been standing for a long time, they would require more etunium and answer or mature bonti shit. Like I was saying earlier, naturally, gravity is going to pull fluid down from the brain. Blood goes into your legs, into your thighs to supply your thighs with muscle, with energy. And so fluid will naturally go down to where the energy is needed, which is blood will go down, which is the legs and the thighs. When that happens, you have more leaving the head, more going down to the feet. Eventually, when the blood doesn't, or the head doesn't have as much, the brain doesn't have enough blood now, you end up, passing out from that. That's usually what happens. And so there's minimal blood in the brain because of everything's been drained down, either because they've been standing for a long time from gravity, and as they've been exercising, marching, the legs have all the blood, and there isn't as much in the brain. And so what can they do to prevent passing out? And the first one is what I was talking about earlier, is drinking as much water as possible. And once you're hydrated now, it will help keep fluid in your system so that even if a little bit is having to go down, now there's some left over in the brain which will help you. Say that instead of so be carry complete, maybe when you brew, no so
Mm.
and number one is hydration. Number two is it's very important not to lock your knees. Yes, remember,
Okay.
every so often, it's important to move your legs around,
Mm.
clench your thighs so you can move blood again. You're trying to get blood to move and to circulation to move into your brain. So either you clench your thighs, move your legs, do something apart from just standing there very stiff.
Mm.
So the other soldier for soldier form or trash because they're not moving. They're
Yeah.
not moving their legs. They're not doing these things. No.
Mm.
And then to know it's important. So if you're having to stand for a long time, maybe at the pulpit and I say marching and I say in the choir, wherever it may be, important to clench your thighs, to move your legs, your thighs, so you're not standing there stiff.
Mm.
It'll really help these situations. So.
Mm.
And I think you can about say avoiding caffeine
Mm.
because caffeine makes you pee, makes you dehydrated. So anything that's going to make you dehydrated, it's important to avoid those things. So some of the few things I can think about. And the final thing I was going to mention is that so when you see brewer, the first thing to do is to sit down. So but not so but down because then you can avoid if you're going to pass out now, you can avoid injury.
Yeah.
And it's important. So when you see brewer, tenacity. And I
Tenacity.
said, yes, tenacity. Yes. And also be when you have
Wow. Doc, nyame nhyira wo. Sɛ w'ani so biriw a tena ase anaasɛ da hɔ. Ɛno ana ka mbɛbusa koraa no sɛ wobɛtwa ahwɛ a wohu anaa?
Pacho can be.
Sɛ obi ɛreba abɛfenti a ɛyɛ a wohu anaa?
No, it's a good question. Yeah, many a times you can tell.
Okay.
Many times you can tell. So
Mm.
about the trash it. No,
Mm.
you can if you're because many to bring me and you might call round. But like I said, not me who
It's okay. Nyahwɛ
like
yɛnto ase.
more puncher me, more
Nyahwɛ
puncher me,
yɛnto ase.
more puncher me. But me who say any brain on number one. Number two, I told him so because I saw spots. I see these dark spots, and I said bright stars. Honum. Told him so wait, like I said, number soon I am really like you can hear some ringing in your ears. It's another thing that can sometimes help. That can let you know say you're about to pass out. And then finally, sometimes feeling very, very hot all of a sudden. All of a sudden, why is shit? That's if you to me all of a sudden. No? These are all signs of clues. Say if you are about trash, so it's not say about home buying.
Mm. Doc, nyame nhyira wo na yɛbɛkɔ nkora mu nso deɛ na me ne wo kasa yɛ ayi question bi abɛsi me tiri no Ghana na metaate na yɛne Ghanafoɔ na ɛdi dwumadi nti menim sɛ yɛka sɛ nketenkete akyɛ obi a saa ɛno wote aseɛ
Yeah, be this all chair at the minimum.
wonte aseɛ ɔ
That means that
ɛbɛyɛ den ɔmo I know ɔmo ntɛn didi no ɔkɔda a na ɔmo akɔ state bi a ebi mu tumi wu fam yana usual si yana say come nketenkete akyi ala ɔmo fira no Ghana ɔmo sɛ nketenkete akyi no ade sɛ bia next meeting bia bɛyɛ
and the same quite home research. I don't know what it means.
ɛno no okay deɛ mɛmɛ ti ase menim sɛ bia
Uh-huh.
ɔmo sugar ne kɔ fam deɛ a ɔkɔ da no usually ɔmo sɛ ɔmo nom alcohol a bia kɔ ndidi wabo na ɔde akɔda anaasɛ kɔm de nyɛ obi a ɔnom alcohol koraa anaasɛ ɔmo sɛ ɔmo duru stage bi a ɔmo sɛ nketenkete akyi ɔmo nketenkete no akyi ɔmo a ɔmo tumi ɛfɛ mu wu ɔmo mpa so na mebisa sɛ no ne fɛnti anaa no bɛ can we attribute
Interesting.
that to say bi a ɔmo sugar ne kɔɔ fam ɛna ɔmo de fɛ mu ewu yɛ mi
Yeah.
diabetes no na Ghana fo no fɛ nketenkete de deɛ a ebi a viewers na ɔmo nim
That's that's a good question,
all right do
But I
there
think what I'm hearing is that some of the causes of sudden cardiac death. That's what sudden death during sleep. Someone dying during sleep. There are many causes of this. And especially in the West. One of the most common causes of sudden death in sleep is heart rhythm problems. It's heart rhythm problems.
Okay.
Because these heart rhythm problems, you don't feel it. You don't, and I said it's just there. And into examples are things like maybe long QT. Now, and if it be long QT, if it be CPVT, they have all these letters to describe heart rhythm. And instead of the heart beating in rhythm, what can all of a sudden happen is it can go into abnormal rhythms. And when it goes into abnormal rhythms, now it be a ten 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 pumping blood no well. And without any help, any way to kind of revive that during sleep, the person is going to die from that. And and especially in children, they have children who die in their sleep, SIDS, I am born for SIDS, sudden infant death syndrome. Many of them are because of heart rhythm problems that you just don't know because you can't tell a heart rhythm problem in a baby unless they show some sign, and that's of a young person. And then oftentimes you find out in autopsy. Say, oh, not a was a heart rhythm problem. We know sometimes another thing that can there's other syndromes like Brugada syndrome. Again, during sleep, it happens a lot in Southeast Asian men. You see, especially more people around 40 years of age, that happen, and especially MEMA. So I could die one sorry, kind of a thing. I could die one sorry. And also no. Again, it has to do with the heart rhythm. There's a rhythm problem, which is why they died. And a lot of this SARS syndrome, when we kind of as an example, which again coming from Southeast Asia, and what happens in this, I'm from Bugada syndrome. And what happens in this, while you're in deep sleep, when they go into deep sleep, and again, the heart goes into rhythm, and these heart rhythms they don't stop on their own. And so, one say back on, we say one sorry. It many times, it tends to be heart rhythm problems that can do that as well, which is very, very difficult because you can't predict it. And no answer is C,
In fact, meaning you remember back me white church, me English church back me pastor, none if you couldn't or could die on any one sorry. In fact, you call one papa and said no sit down na or the die na no one or the one
yes,
yes.
yes.
Getting the air for papa nebusan saying
Maybe no. Maybe no matter yes.
Moment me actually as you yɛhwɛ nkura nketenkete nkura nso deɛ nkura nso
Yeah.
then ɛsi a interventions the same CPR no yɛnsa mmienu ba nneɛma kakra na ɛmfa mmerɛ wie
Yeah, and also it's very, very important. CPR in a child is a little bit different from CPR in an adult person. MC can say in adults, you want to be able to bring both hands together and push in the middle of the chest, So before we're talking, 1 month, 2 months, 3 months, it be a client that on now on home. And as you hear now only pause at that time. Now what you do is you encircle your hand around them. So now to me don't thumbs, in near the coconut sono. It's in the coconut sono as a way to get the CPR not done. And that's how you usually do it on very, very small infants. Is to encircle your hand around them and then push down with your thumbs. Because all the kakakaniya na oftentimes you could cause more injury than good. But in the grand scheme of things, if that's what needs to be done now, it's better to do that than not do anything at all. It's it's better to do something than to do nothing. It's so more front yes and now second the hands around the thorax and then pushing down is very, very helpful for CPR in young ones.
Doc, na menhyira I think say had a brave my okone na di dwumadi no aba
Yeah.
yɛsua nneɛma bebrebe yɛsua nneɛma bebrebe nti I think say adeɛ baako a ɛno deɛ ɛwɔ sɛ yɛ making sure sɛ all churches asafo bia a wɔwɔ mu ɛsɛ ti nya ɛyɛ AFib ne AED ne bi ɛno deɛ I think say
yes
asafo no matter how expensive it is
yes
ɛwɔ sɛ yɛ kwan biara yɛbɛnya bi wɔ hɔ no because ɛwɔ hɔ a doc sɛ okay yɛbɛgye nkwa yɛbɛgye nipa bi nkwa na adeɛ wei nso nipa yɛ membership no bi nyini ne yɛapɔmuden ho nsɛm kɔ fam no tendencies sɛ yɛbɛhu bi no yɛ very high yɛbɛhu bi no ɛyɛ very high nti yɛnhyɛ saa nneɛma no nyinaa nso menim sɛ bia wɔ last words bi a oh by the way sɛ deliverance ntwahwɛ ɛnde nyɛ hospital di no
the mama suffer Yeah, much church, yo.
ọmụ asọfo ọmụ mba ọhụrụ nkọkọ chere.
Ɛdɛ ma sɔfo no bɛyɛ ho adwuma ama yɛ.
All right. Nti a na bɛbɛ bɛ wɔkɔ ne nɛ yɛde yɛapɔmuden ho nsɛm no aba awie yɛne Dr. Manu ɛna ɛtwitwe nkɔmmɔ ɛfa kwan fainting ɛne sudden cardiac death ɛyɛ a na ɛsisi bebrebe no deɛ wo bɛtumi ayɛ ne deɛ mimi bɛtumi ayɛ. Wowɔ question biara de fa go comment section hɔ. The next one yɛba a yɛde ho nsɛm ɛbɛbrɛ mu. Doc, nyame nhyira wo, nyame nhyira wo paa sɛ
Nyame asɛm ama mɛba line no sɛ menhyɛ yɛ nyinaa.
all right ɛnɛ yɛmmɔ mpaeɛ. Awurade yɛde wase sɛ waboa yɛn na yɛde ɛnnɛ nso de aba awie. Yɛsrɛ wo sɛ ma yɛn mu biara nkɔ ɔhaw wei mu. Na mpo sɛ bi tu obi a ɛyɛ aboa yɛn ne ma yɛ nimdeɛ a yɛn nso yɛbɛtumi ayɛ deɛ yɛfa mu deɛ na yɛtumi de agye ɔmo nkwa. Hyɛ wɔ Yesu din mu nti amen.
Amen.
All right, Doc, nyame nhyira wo. Ɛneɛ, bye
Menhyɛ
bye.
mo so so. Bye bye.